Coming up,
I'm just going to feel right there. Good.
Dr. Sam Rasool breaks down holistic healthcare and demonstrates how tightness in your neck could be causing discomfort in your back, hands, and more. Then, join us for another SoFlo museum hidden in plain sight. From the building architecture itself to world-class pieces, this collection has something for everyone. Speaking of everyone, just about anyone can enjoy the benefits of extra virgin olive oil, and we'll share why. All that and more is today on SoFlo Health. Hello and welcome to SoFlo Health. I'm Hunter Frankie. We're in Miami Beach on Washington Avenue, and this is the bridge tender house that used to be on the drawbridge at 27th Avenue, which spanned the Miami River. And if you needed to get through with a boat, somebody in this house would let you through. Well, how did it get here? Well, it's because it's a part of the Wolfsonian where we are today. What's the Wolfsonian, you ask? That's a great question. It's this building that has been here since 1927. It used to be a storage facility, and now it's a wonderful museum that we're going to explore today with Casey, who's inside. Let's go see him. And I'm now joined by Casey, who is the director of the Wolfsonian FIU. Casey, thanks for having us in today.
Glad to have you here. Wonderful to do this tour and tell you about the Wolfsonian today.
I'm excited to hear about it. Just walking up, the building is absolutely impressive. Tell me about the architecture and how long this building's been here.
So the building was opened in 1927. It was originally a storage warehouse. It continued in that role up until the 1980s when Mickey Wolfson, or Mitchell Wolfson's, purchased the building because at that point his collection was the main contents and turned it into the Wolfsonian. It's a very unique collection. We're about objects of the modern age, objects that help tell the story of what it means to be modern and help understand political changes, social changes, technological changes from the period of 1850 to 1950.
What would you say the average person can expect to see when they come here?
Wow. So the collection's really diverse, and most often the word that you will hear people talk about is eclectic. It's fine art, it's decorative arts, it's propaganda arts, it's everyday applied art. Where the Wolfsonian's unique is that we always bring all of those pieces from our collection together to tell a narrative.
Great. And how often are things changing here? People have been recently and they're saying, well, when are things going to switch up?
So I have to say the past year we've been a little reluctant to change. We've had a lot of other activities going on.
Sure.
But starting in May, we'll be opening a World's Fair exhibition. So that one is currently in installation, so that one's going to be spectacular. World's Fair feature heavily in our collection.
People would like to keep up with what you're doing because you have so much going on. How can they?
So our website's the best spot, and that's easy to find, wolfsonian.org. The other place that we put a lot of material and we're really focused on is our Instagram account. So check that out. Follow us on Instagram. We do wonderful projects there, reels, talking about the collection, and different stories will appear there. There's always an object of the week that you can peruse and learn something about.
Great. So before I get to exploring, is there anything else you'd like to add or you think is particularly important about the Wolfsonian?
You know, I think you just need to go and see all the objects because that's really going to be the thing that really seals the deal for you. I think that's the thing that every visitor typically comments in the book and our comment books is just the amazing collections that we have.
Great. Well, Casey, thank you so much for giving us some education before we head in. And like, this is just the start, so I'm excited to see what else is there.
Wonderful.
Thank you so much.
Thank you.
You got it. Welcome to Align Chiro Care with Dr. Sam Rasool, who you've seen many times here on SoFlo Health. And something else you've probably heard many times from many practitioners is holistic healthcare. And what the heck does that mean? Dr. Sam, you were the best one to tell us in this situation. So what is holistic healthcare in your view?
Well, Hunter, holistic healthcare is exactly what it is. It's whole body, whole system. You're not just a shoulder, a knee, or a foot. You are Hunter. all systems go. So there are many people that have different ailments, and you could be missing it if you're not looking at the whole body.
So if I have back pain and I go see a specialist and they're going to look at my back, I assume, how would that be different in a holistic approach?
A lot of times I'll have patients come in and say, my middle of my back is just killing me. I'm getting massages. I've gone to a chiropractor. I've done physical therapy. I've taken medicine, not helping. Or another thing I see commonly, I'm getting numbness and tingling in my fingers. So a lot of times we see it more and more, especially with text neck in our day and age. So most people hold their phone like this. They're putting an extra 50 pounds of pressure on their neck. And what happens? The mid-back compensates, and then those nerves get basic compromise, you get numbness and tingling.
How would something that's happening over here affect, say, my fingers or my back?
Exactly. So I'm going to take Hunter and go like this. So if you see from a side view, Hunter actually has very good posture. A lot of people, though, I'm going to go ahead and give you the bad posture, Hunter. He juts his head forward like this. So what happens is now he's lost the curve in his neck. And what happens is you're putting excess pressure on the discs and the nerves from the neck. Well, a lot of times the body is very resilient. It'll do everything it can to try to save the neck. So you get tension throughout the mid-back, and or those nerves that are being pressed, sometimes they don't contribute to pain, but other symptoms like numbness and tingling go down the hands. So if you go see a doctor, and if Hunter, go ahead and turn this away again. If you go see a doctor and they're like, I have numbness and tingling in my hand, well, many doctors, many physicians will say, okay, let's look at the hand and the wrist. So people think, oh, I have carpal tunnel. It could or could not be, but it could actually be coming from the neck. That's, again, going back to the holistic approach. Look at the whole system.
We'll show you how you can actually address text neck and give you an example of how holistic healthcare works. So keep watching SoFlo Health. More from the Wolfsonian, the benefits of olive oil, and what women need to consider for a healthy heart is here when SoFlo Health returns.
Focusing on you. Innovations in modern medicine. From your team of experts at Desai Seti Urology Institute, part of the University of Miami Health System.
Julie Alvarez Medina was nervous to leave her home without knowing where the nearest restroom was.
I was having a lot of problems with hesitancy and having to go to the bathroom over 16 times a day.
Julie had overactive bladder. She went to see Dr. Raveen Sayan, a urologist at the Desai Sethi Urology Institute, part of the University of Miami Health System, who specializes in pelvic floor disorders.
The overactive bladder is a condition that's extremely common. It's characterized by your symptoms. So going often, going urgently, maybe having leakage. There are 3 advanced therapies. The most effective is called sacral neuromodulation. It is like a pacemaker for the heart, so it's like a little wire attached to a battery that sits under the skin.
This is the size of the rechargeable battery that's implanted inside the patient. The device stimulates the sacral nerve, which sends messages to the brain, improving bladder function.
When we target the sacral nerve, which is a nerve way down low at the level of the tailbone, and we give stimulation continuously, it significantly improves symptoms of overactive bladder.
After I had it done, I was like, I should have done this earlier.
Julie uses a remote control to adjust the amount of stimulation. Now she is back in control of her life.
It really has been life-changing.
We are now at the Harry Clark in the Geneva Window exhibit here at the Wolfsonian FIU in Miami Beach. Welcome back to SoFlo Health. I'm Hunter Frankie. The beginning of this is the story of Harry Clark, followed by him being commissioned to make this beautiful piece, which is the Geneva Window, originally intended to be a gift from the Irish government to the League of Nations, but they thought it was too provocative, so that never took place. And now we have it. However, if you take a look, you can see that those individual panes are all a reference to different literary works of the time. And you can spend hours just dissecting each character, the colors, the craftsmanship that were required to put that all together. And as Thomas Bodkin said over here in this quote on the wall, it's the loveliest thing ever made by an Irishman. Cardiovascular health is important for everyone, but we came to Mount Sinai Medical Center today to meet with cardiologist Dr. Mechanic to find out why women particularly need to pay attention to their heart health, especially after menopause.
There's a somewhat of a misconception that women don't get cardiovascular disease as often as men do. And actually, that's partially true. Before age 55, women have much lower rates of cardiovascular issues compared to men. But once menopause hits, that gap actually narrows substantially, and it gets to a point where women's cardiovascular issues and cardiac disease surpass the rates of men.
And are there reasons for that hormonally, or is it just aging?
Estrogen plays a huge role. We believe that estrogen actually has preventive properties, and while women are premenopausal, estrogen is promoting good levels of or high levels of healthy cholesterol. Estrogen also relaxes the blood vessels.
What are some of the symptoms that women might experience that they don't even think of as being a heart-related symptom?
Women don't manifest heart disease or the symptoms of heart disease the way that men often do. For example, the elephant that's sitting on my chest is indicative of a heart attack. In a woman, those symptoms can be so much more subtle. If something doesn't feel right, take it seriously.
When should someone come see you?
Know your family history. If you have a strong family history of heart disease, know about it, ask about it, and then come to your doctor for a checkup.
What are the typical courses of action to treat a lot of these diseases?
Lifestyle is huge. Diet and exercise, having good sleep, stress management.
What are you doing differently here at Mount Sinai that somebody might not find somewhere else?
You have highly qualified physicians, team members, nurses, technicians who strive to give the best quality care. Besides the expertise, we really care here at Mount Sinai. We care about the patient in front of us, who they are as a person, not just the pathology or whatever issue they may be having. And we also care about the people around them.
Thank you so much for your time. If people would like to learn more, how can they?
Visit us on our website and give us a call.
Great. Thank you so much, Doctor.
Thank you.
Have you ever picked up a book like this and thought to yourself, they sure do talk about olive oil a lot? And then do you think to yourself, is olive oil really that good for us? I actually think so, but let's press on with some benefits of extra virgin olive oil and you can decide for yourself. Let's start with inflammation, a common thread in chronic disease. Some practitioners view extra virgin olive oil's oleocanthal as an anti-inflammatory that has similar effects to low-dose ibuprofen. Polyphenols, by the way, are a group of plant compounds known for their anti-inflammatory and antioxidant properties. If you like having a healthy heart, then extra virgin olive oil's ability to optimize cholesterol ratios and reduce hypertension are for you. Studies have shown a 5 to 10 point drop in systolic blood pressure in those who regularly consumed extra virgin olive oil. Extra virgin olive oil also has metabolic benefits, with studies showing a 20 to 30% lower risk of type 2 diabetes in populations with high olive oil intake. Extra virgin olive oil is also great for your brain health. It supports good memory and protects you from Alzheimer's, at least in studies for animals and humans. In fact, a 2017 study showed that extra virgin olive oil can enhance the blood-brain barrier and reduce neuroinflammation, which again is just a fancy way of saying it protects your noodle. I know that was a lot of information, and you might be wondering, where do I even begin with all of this extra virgin olive oil? Well, you can start with cold-pressed olive oil in a dark glass bottle, ideally harvested within the last 18 months to ensure high polyphenol content. All it takes is 1 to 2 tablespoons per day to reap the benefits. And it's best consumed raw or lightly cooked below 350 degrees to avoid disrupting the bioactive ingredients. As with any food, olive oil isn't going to solve all of your problems, and you do need to be mindful with your portions. Consuming more isn't necessarily better. However, it's simple to get in your diet, or you can also consume olives if you prefer. You will get a slightly smaller but similar effect. Now, you can just drizzle it on a salad, put it on toast instead of butter. The possibilities are endless. This is St. Andrews Estates, one of two ACTS communities, the other being Edgewater at Boca Point. And we're here to meet Carlene Starace, who is a resident here at St. Andrews, enjoying her vibrant and active lifestyle in retirement. So let's meet Carlene and find out more.
What brought us here to ACTS, St. Andrews Estates, is actually Hurricane Irma. I was on the roof, I was putting the shutters up, and it was like a nightmare. So I said, you know what, we can't do this anymore. We need to get our act together. We came to an introductory presentation, and we liked it. My husband is a little bit older than I, and we wanted to get to a place where we would have different stages of care if we needed it, and that's what St. Andrews provides. It's a peaceful environment. We have, I think it's about 70 acres, smack in the middle of Boca. There are museum trips, there are dinner trips. You can partake of those if you like, or you can go to a lounge and read a book. We have great exercise classes. We actually have mat yoga class. We have chair volleyball, which is very fun. We have entertainment every week on Tuesday nights.
Carlene is clearly enjoying her community here and all of the activities that come along with it, but she's also thoroughly enjoying the worry-free lifestyle that comes with not having to maintain a property yourself.
There are no hidden costs. You have one price. You don't have things like your homeowner's insurance, you don't have real estate taxes, you don't have electric bill, you don't have the upkeep, the maintenance, and all of that. My favorite part is the security and the comfort of knowing this is where I'm living, this is my last move, and if I need anything, it's right here for me.
For more information, please call 561-961-8541 or visit our website.
Dr. Sam Rasool shows us examples of holistic healthcare in action, and we salute our nurses after the break on SoFlo Health. Welcome back to SoFlo Health. I'm Hunter Frankie. This is Dr. Sam Rasool, and we're at Align Chiro Care, where earlier we were talking to you about holistic health care and how something that hurts in one place may not be stemming from the place that it hurts. The real question is, great, I know that it's coming from somewhere else, but what do I do about it?
What we can do from a chiropractic standpoint, we want to get those joints moving. So I'm going to have you go face up for me.
Okay.
So remember, guys, we've already done a full examination assessment on Hunter. We know exactly what he's dealing with. We like to do that with every single patient before we do any type of adjustment. So I'm going to take his arms like this, and I'm going to come to exactly where I found on him. There was a restriction right in the mid-back right here. So he's going to give me a deep breath in. And as he lets all the air out, relax his shoulders. There you go. Just like that. Let's add a little bit more air. Now I can actually get those shoulders pulled back, but we don't want to forget the neck. I'm going to bring him to the side. I'm just going to feel right there. Good. That's how restricted you were, my friend. Yeah, and you got a little one here too. Now what you're going to do here is tip your chin up a little bit. There you go. There it was. Easy. Let me do a little stretch just to open up those joints. Take the pressure off those nerves. Easy peasy.
So Dr. Sam, a lot of people will either be open to that or not, but regardless, when you do resolve an issue like this, how do you keep it from coming back?
It's up to you to kind of avoid those lifestyle landmines. So you really want to bring your phone up when you're working on it. And I don't expect it to be like this, but bringing it up here. Look with your eyes, not with your neck. When you're sitting at the dinner table or on the couch, you want to have a pillow in your lower back to kind of sit up straight where you're not having your shoulders curve forward. Mm-hmm. This is going to allow you to take the pressure off not only your back, but your neck, which is not going to lead to the problems that we pointed out earlier.
Great. Well, Dr. Sam, if people want to find out more about you, how can they?
They can contact us through our website, miamichirocare.com. We can answer any questions you may have, or if you want to set up a consultation to come into the office where we can actually chat about what you have going on and how best to treat it.
Thanks so much.
No problem.
You got it. Behind me is Catholic Health Services St. Anthony's Rehabilitation Hospital, and we're here to see Josie. She is the Director of Nursing. This is all part of Local 10's Salute to Nurses initiative. So let's go meet Josie. I'm now joined by Josie. She is the Director of Nursing here at St. Anthony's Rehabilitation Hospital. Josie, thanks for joining us.
Thank you to you too.
Of course. How long have you been a nurse here?
Oh, I've been a nurse at CHS for 12 years.
Excellent. And what do you love about nursing?
Oh, nursing is my passion. Since I was a little, I always want to be a nurse. I love to take care of people.
What would you say to new nurses out there that are getting ready to get into the field?
To tell them nursing is about passion, caring for people. It's not always about the money. It's about caring. You have to be loving what you're doing.
What is your experience like with your patients? What do you hear from them?
Always thank you. You make me feel like I'm home.
Why is it important for nurses to be passionate and caring in what they do for the patient?
This is patient life you're dealing with. You know, if they come here, so you have to make them feel that they're comfortable, they trust us.
What makes a good nurse?
A good nurse, always about caring. If you cannot care for the patient, you cannot be a good nurse.
Josie, thank you so much for sharing with us and for what you do on a regular basis. We really appreciate it.
Thank you as well for you. Thank you. Thank you for your time.
Of course. Welcome back to SoFlo Health. I'm Hunter Frankie, and we are wrapping up our time here at the Wolfsonian FIU. And behind me is the main entrance. You'll see this when you come and visit, of course. And this was once the facade of the Norris Theater in Norristown, Pennsylvania. And it's now living here as a beautiful fountain at the main entrance. And like everything else that we've experienced here today, you can just spend an hour looking at all of the intricacies of this period of time that the Wolfsonian has captured. And we've only brushed just over a little bit of their collection. And as you heard from Casey earlier, they're always changing things and adding something new for you to see. And if you're so inclined, you can always check it out for yourself. And as Casey mentioned earlier, they have that World's Fair exhibit coming up, which I'm personally excited to see. It has a lot to do with TV. And as you know, that's what we do. And that's what we have for this week's episode of SoFlo Health. Thank you so much for watching. As always, if you'd like to watch previous episodes, you can do so on SoFloShows.com. You can also follow us using @SoFlo Health to share with us what you're doing to stay healthy. Until next week, it's goodbye and good health.